Hi, I'm Matthew Clausen with MedigapSeminars.org, and in this video we will be discussing Medicare and the cost of cancer treatment. Now this video is for everybody that is either on Medicare or soon to be on Medicare. We're going to talk about the advantages and the disadvantages of Medicare Advantage plans, Medicare supplements, and your Medicare Part D prescription drug plans when it comes to handling the cost of cancer treatment. In addition, we're going to show you how you can reduce your financial risk in the case of a cancer diagnosis. Cancer can present a risk not just to your health, but to your financial stability as well. Cancer is the second leading cause of death in the United States, and in 2016 alone, it's expected that over 1,700,000 people in this country will be first diagnosed with cancer. Chances are you already know of someone or know someone who has battled cancer, so you understand the emotional and the physical toll it can take on you. When a doctor first uses that word, cancer, the patient goes through an emotional shock. How serious is it? What kind of treatment? What do I do now? But the one thing that they shouldn't have going through their mind is, how much is this going to cost? Cancer is one of the most expensive conditions to treat. Even with the best insurance, a typical patient will spend thousands, if not tens of thousands of dollars battling cancer. Currently, a typical cancer drug costs about $10,000 a month. Some drugs cost $100,000 for a treatment. As a matter of fact, recently there was a new drug released to treat melanoma by Bristol Myers Squibb. It cost $147,000 for a 12-week treatment with a 60% success rate, and over $250,000 if it's needed over a full year. Needless to say, one of the growing trends in cancer treatment is the inability for a patient to afford the treatment that they need. The questions that we're going to try to answer in this video is, with Medicare, how much of these costs will Medicare cover? How much are you going to be responsible for? How much should you have set aside in a financial war chest to help fight and battle cancer so that the decisions you make are not based on your budget? As we go through this discussion, what I've done is I've broken down the costs of cancer into two different categories. There are direct costs and there are indirect costs. Direct cost is really directly paying for a service or a medication. If you have to pay a portion of a medication, that's a direct cost. If you have to pay for chemotherapy, that would be a direct cost. Indirect costs are costs that you're going to incur in order to get better treatment, but are not directly related to a cancer treatment or a cancer medication. For example, let's say that you have Medicare and you decide to go to either MD Anderson in Texas or Sloan Kettering in New York, through the top cancer specialist facilities in the country. And well, to go there, if you're going to have to pay for the flight, you're going to have to pay for the room and board during the time that you're having treatment. And those kinds of costs are indirect costs. So we're going to go over both of them and what you should expect depending on which type of Medicare that you've chosen. It's also important to understand which part of Medicare handles which part of the services. Some of your cancer treatment is going to be covered under Medicare Part B or the Medicare Advantage equivalent. Some of it will be covered under the Medicare Part D prescription drug portion. And this is important because which portion of Medicare covers what treatment is going to define your level of financial obligation and your level of risk. And so this is where we're going to start. Here is the rule of thumb. And understand this is just a rule of thumb. Rule of thumbs do have exceptions. The rule of thumb is that if you have a treatment that is provided by your doctor at a facility or at your doctor's office, whether it's an injection or a pill, it's not self-administered, it's given to you, those are typically covered under your Medicare Part B or the Medicare Advantage equivalent to Medicare Part B. If the doctor writes you out a prescription and hand you that prescription and instructs you to go to a pharmacy to pick the drug up, and you are self-administering that medication, then that medication is more likely to be covered under your prescription drug Part D program. Chemotherapy and many of the related medications that are not self-administered are covered under a Medicare Part B. Those that are already on a original Medicare and perhaps with a supplement are aware that Medicare Part B pays for 80% of the covered services, and that leaves you responsible for 20%, or if you have a Medicare supplement, it would be your Medicare supplement that would be responsible for that 20%. With most Medicare supplements, you'll have very little financial exposure to this portion of your cancer treatment. If you have a Medicare Advantage plan, you should check your summary of benefits. You're required to receive a summary of benefits before you actually signed your Medicare Advantage plan for the year. And typically take a look right before it starts talking about, or right as it starts talking about prescription drugs, and you're going to see something like this. And for most Medicare Advantage plans, your Part B for cancer, your chemotherapy and such, your Advantage plan is going to cover 80%. You're going to be responsible for 20% of the costs. Now, every Medicare Advantage plan is different. Every plan is different. So please check your summary of benefits specifically. As it just shows in here, it will specifically address chemotherapy and tell you what your responsibility will be. If you have an HMO, there will be typically no out-of-network insurance coverage. So usually, not always, but usually when you have an HMO, you will be responsible for 100% of any out-of-network services, and then typically 20% for in-network services. If you have a Medicare Advantage plan that is a PPO or a regional PPO, then it will have different levels of services for both in-network and out-of-network. In-network, you're typically going to be responsible for 20%. Out-of-network, it will depend completely on your plan. The good news is that your chemotherapy, along with everything else that's covered under your Medicare Part B equivalent, is subject to your maximum annual out-of-pocket limit, something we call a MOOP, M-O-O-P, for maximum out-of-pocket. That MOOP is going to be different for every plan. For many of the PPOs, it's typically $6,700 a calendar year for in-network and $10,000 a calendar year for out-of-network. HMOs can be the same or they can be less. It's also going to depend on the plan year. As I'm recording this video, it's 2016. Those maximum out-of-pockets that are typical can change each and every year. This is good news because it limits your financial exposure. It doesn't matter what your Medicare Part B portion charges are, you will be limited on any calendar year basis to that maximum out-of-pocket expense. If it's $6,700, then you will be limited to $6,700 for that calendar year. Keep in mind, however, it is based on a calendar year. It does reset on January 1, and it excludes your Medicare Part D prescription drug portion. In other words, the portion of your plan that refers to prescription drugs does not have a maximum out-of-pocket limit. The other thing to consider is Murphy's Law. People do get sick in October, November, December. You can very easily reach your maximum out-of-pocket limit in the last quarter of 1 year, have it reset on January 1, and you start all over again the next year and very quickly incur your maximum out-of-pocket limit. It's not uncommon at all. It happens a lot, so at least be prepared to pay twice your maximum out-of-pocket limit. If you have original Medicare, then your maximum out-of-pocket limit is going to depend on your supplement, and it can be as simple as a copay or as low as zero, depending on your supplement. For those with original Medicare and a Medicare supplement, your financial risk for the Medicare Part B charges is rather minimal. So let's review what we've covered so far. Chemotherapy and other cancer treatments that are not self-administered are typically covered under Medicare Part B. If you have a Medicare Advantage plan, then your first financial risk is the direct cost of chemotherapy and these other not self-directed services, because you will be responsible for 20% of the cost up to your maximum annual out-of-pocket expense. If you decide to go to a specialty cancer treatment, then these services may be out of network, so you'll have your out-of-network maximum out-of-pocket expense in addition to the travel expenditures and lodging from going to a specialty clinic. If you have a Medicare Advantage plan, then you can expect between $14,000 and $20,000 in direct expenses for Medicare Part B services. If you decide to go to a specialty cancer treatment service that's in another state, then you may have some indirect costs as well. If you have original Medicare and a Medicare supplement, then your Medicare Part B coverage is going to be limited to your Medicare supplement. It could include some copays, or it could include, it could be zero. But your Medicare Part B exposure will be limited by your Medicare supplement, and it will not be the biggest issue in handling the cancer treatment. But keep in mind, in both cases, none of this includes your prescription drug Part D charges, which we are going to go over next. I would like to note, if you are a Florida resident and you have a Medicare Advantage plan, or you're considering a Medicare Advantage plan, there are at least two Medicare Advantage plans that will cover some of the out-of-state clinics, so that you can actually go to something like an MD Anderson for specialty service and have in-network costs. In other states, regional PPOs may also cover that. Contact me, let me know, and we'll take a look for you. So this brings us to Medicare Part D for prescription drugs and what you can expect for that to pay in your cancer medications. Medicare Part D is that portion of Medicare that handles your prescriptions medications. Your prescriptions medications are those where your doctor has written a script. You are expected to go to a pharmacy to purchase your medication and self-administer your medication. If you have original Medicare and a Medicare supplement, you're going to have a standalone prescription drug plan. It'll be separate from everything else that you have. If you have a Medicare Advantage plan, the chances are your prescription drug plan is bundled into that. You didn't have the opportunity to shop for your own drug plan. You got the one that was bundled with the Medicare Advantage plan that you decided to join. In either case, your Medicare prescription drug Part D plan charges are in addition to the maximum annual out-of-pocket that you may have with a Medicare Advantage plan, and they are completely separate from any of your other charges. And to be clear, there is no maximum annual out-of-pocket expense for any of your prescription drugs. The way it works is that your prescription drug, your Part D drugs, will have a co-insurance. Not a copay where it's just $5 or $10, but a co-insurance where you're going to pay a percentage of that drug. It's going to be different with every plan. In some plans it's going to be 25, 35%. Other plans it can be 50%. And you will pay that co-insurance until you've reached a certain maximum out-of-pocket. There are things they call the donut hole and other complications I don't want to get into on this. Suffice it to say that with a prescription drug for cancer, you're very quickly going to reach what we call catastrophic coverage. In 2016, catastrophic coverage is when you've had $4,850 in out-of-pocket expenses. Once you've reached that, then Medicare is going to pay for 95% of the drug. You're going to pay for 5% of it. There are some exceptions where there are copays, but typically in cancer drugs, that is the way it works. Now, according to the Journal of Oncology Practice in May 2014 publication, the average cancer patient, not just the average cancer patient on Medicare, but the average cancer patient in general, paid out of pocket between $20,000 and $30,000 for their prescription drugs. According to the Kaiser Family Foundation in their studies on Medicare, the average Medicare beneficiary with cancer is going to pay between $7,000 and $12,000 out of pocket for their prescription drugs. Most of that is incurred after you've reached that catastrophic coverage. This bar chart, which is produced by the Kaiser Family Foundation, shows some of the costs for the typical Medicare Part D enrollees pay for specialty drugs. And the last three down here in the bottom are cancer drugs. The gray area is what you're going to pay before you reach catastrophic coverage. And the dark blue is actually what you're paying after you have reached catastrophic coverage. But you can see your totals in here between $7,000 and $11,000, and that's just for these particular drugs. So this graph here we're looking at from the Memorial Sloan Kettering Cancer Center shows that the median and monthly cost for cancer drugs through the years. And what it's showing is they're currently around $10,000 per month, with some close to $100,000. Remember, after a certain level of out-of-pocket expenses, $4,850, you reach catastrophic coverage where your cost is limited to 5% of the drug price. But this is a monthly drug price, and there's no limit on what you might pay. So again, in 2016, the catastrophic reaches is once you've already had $4,850 out of pocket. The bottom line is that even with the best Medicare Part D prescription drug plan, your cost when you're on Medicare for cancer drugs is likely to be in the tens of thousands of dollars, and this is in addition to any of the costs that you may have incurred under your Medicare Part B. So what does all this add up to, and what do we do about it? Well, first, my hope is that you found the information on the financial risk that you're facing with cancer useful. I hope it's information that you can use. As an independent broker, my goal is to make sure that you have the information you need to make informed decisions, and the last thing that I want is unsettling surprises that you can't do anything about because it's too late. So at least with this information, you have the opportunity to take action to try to solve this risk before it's too late, before you've already been diagnosed. A study that was presented in 2014, and I have to read this, by the Palliative Care and Oncology Symposium, 2014, found that 64% of cancer survivors reported major financial problems as a result of the expense of fighting cancer. They were either overburdened by debt, had to file for bankruptcy, or have even had to return to work to help cover the expenses that they incurred fighting cancer. I certainly would hope that that's something that we can avoid. I wouldn't want to have to do that myself. Of course, wherever there's financial risk, you're going to find an insurance product that will help to protect you from that financial risk, typically for pennies on the dollar. For very little premium, there is an insurance you may be able to qualify for that will provide you a lump sum of cash on the diagnosis of cancer. This is a policy that pays you. It doesn't pay your doctor. It pays you a lump sum of cash, and it pays you when you are diagnosed. So with the first diagnosis, you can receive a check for $10,000, $15,000, $25,000 or more, up to the amount that you choose. It's typically limited to $100,000. And you receive that check as soon as you're diagnosed, before you have to go through treatment. So you can use that money to make your decisions on how you're going to battle cancer. You can use the money to go to a specialty clinic. You can use the money to cover your Part B expenses or your specialty drugs. This money is your war chest to help you battle cancer. Receiving a lump sum of cash, and you can choose the amount, on the first diagnosis of cancer is really the perfect product for filling in the weaknesses in Medicare and the enormous costs of the cancer drugs that we have to pay. And it's really there so that you're not put into a financial hardship at really the worst moments of your life. You'll want to be able to make a decision about your health care based on your best interests and not your budget. The cost is very reasonable. The premiums never increase. And if you're interested, you want to take a look and see if you qualify for the plans or what they would cost you, just fill in the contact information below. We'll be back in touch with you. We'll give you the prices and the other information that you need to see if you qualify and to see if this is the right product for you and your budget. The objective, as always, is to give you the information that you need so that you can make an informed decision. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.